Food. All right, we are gonna go ahead and get this shindig started. Welcome to the February Health Council meeting, also known as 211 Day. Did we do anything big for 211 Day? No, but we had this meeting, so yay. So we have a busy schedule, so we'll go ahead and go through this. Time is 12:03. We picked up one new member since January, and that's Anali Moreno. If I mispronounced your name, I apologize. She's with KBIM Radio. In your packet is the minutes from last month. Is there any corrections to the minutes? All right, assuming there is none, I'm gonna go ahead and move on then. And that opens to board nominations. So every 2 years, the board is elected or reelected for the health council. We are now at year 2. So it is time to do your nominations. That's not us. So we are looking for secretary, treasurer, vice chair, chair, and then the board members. In your packet on the very last page, guys. So the second to the last page will tell you about the health council and the key activities of what it is to serve on the board and what the requirements and the duties and responsibilities are. And the last page is the nomination form. For those that are choosing the board member, then you select a subcommittee, youth education, behavioral health, Health Expo, Food Insecurity, Together with Veterans, the 211 resource line. The Valley representative needs to live and or work in the Valley. So that would be Dexter, Hagerman, Lake Arthur, somebody who has a connection within the Valley itself. So that way we can get more information down to them. So if you're a Roswellian, that is not for you. So if you're interested, you can fill out your form and turn it in to me at the end of the meeting. If you're online, if you can email it to me, by the end of the day. Is it just one day? Oh, by the end of the month? Within 10 days?
Yeah, it's gonna be a couple of weeks, just by Friday, think about it.
Yeah, we'll do 10 days because I don't like open-ended because then you guys forget about it. You have to do it today, make it urgent, so you do it. Does anybody have any questions about the board nominations? Anybody online? All right.
Anyone copy?
Does somebody online have something? Okay. With that, then we'll move to the health council activities. The behavioral health and wellness. I know Elizabeth isn't on, Kim. Did she send anything with you?
She did not send anything with me, I was just texting her. I'm not sure, she must have a conflict today.
Okay. All right, and then update from Together with Veterans. Danny, are you on? I didn't see her.
Okay.
Yes.
Oh, she is on. Okay, go ahead, Danny.
Sorry, I have my 8-week-old with me, so he's talking. So we just had a very good breakfast with for veterans on Saturday. We had 72 attendees. We have a Narcan training coming up at our next team meeting on the 21st of February. Which starts at 11:30. And we do provide lunch. We have a QPR training next month. And just plug along to be graduating from the program towards April. Jen, is there anything I missed? I'm pretty sure it is.
The meeting is the 21st.
And it'll be a Narcan training. So if you need Narcan training, if you want to be a trainer of Narcan, you can attend that as well and become a trainer.
Would be 21st.
It'll be at the American
On the bottom of
Legion
your
Post
sheet.
28.
It's at the bottom of the agenda. I see it. I don't mind.
Anything else, Danny?
Oh, I got married and my last name's now Andrade.
Okay.
No,
And we'll
I'm
all
good.
remember that. Yeah, there we go. Let's you get the snaps
Woo! Thank you.
and a bag of chips. All right, then that moves us to the Health Expo.
The first meeting is March 2nd. We're not having many meetings. I think we're having 3,
Yeah, we're gonna keep it short.
short and sweet. On the first one on March 2nd, we'll have packets ready. Then, Carrie and I are always available for questions in between the meetings. So we're gonna have one in March, one in June, one in July. And that'll be all, it's gonna be at the mall again. It'll be August 1st. From 10 to 2. We'll do setup before that. We'll have the run going on. All those details will be coming in the next couple of weeks. I think that's it.
And the big change with it being at the mall is this year, we're having a company bring in tables and chairs because that was a pain in the butt last year.
It was so terrible. So we will be doing booth fees again because we have to pay for tables and chairs. But it makes it easier. Everybody, if you don't have a booth fees, no, not last year. Not
Yeah,
last
we had booth fees. They were just very,
Oh, they were very cheap.
they were, yeah, it was like $25. So we bumped it back up.
It's back up to the normal, what the normal booth fees were, $50 for the early bird, 75 if you go after the early bird deadline. Okay. We still have the sponsorship. Yeah, we still have the sponsorships and all of that the same. They're formatted just a little bit differently, but basic idea is still the same.
And if you're wanting to be a presenting sponsor, you need to hit me up early. I can always put your information on the packets as we go out. But the sooner you want to be the presenting sponsor, the more information I can get out on you. The longer it takes you, the longer it takes me to put it all together.
What is a presenting, like, what's the difference between a sponsor and a presenting?
So the presenting sponsor gets the preferred booth area because it's 10 booths. So
It's the $5,000 level.
yeah, so they get kind of like their own little wing to put all their booths in, so that way they can,
You get a lot of booths and you get every single perk that there is.
all the advertising, you get the back cover of the wellness guide. You could put a story in the wellness guide if you meet my deadlines. So yeah, there's a lot more perks on the presenting a sponsor. All right, any other questions on the Health Expo?
Many presenter sponsors can you get? Is it just one?
We normally have just the one, we could probably get away with 2. Because I'm pretty sure, yeah, I can get away with 2.
Those 10 spaces are a lot. So
Yeah,
you do have to limit those. So it's a kind of a first come, first served type thing. So if you're thinking you might want it, like as soon as we get those forms out, get it right back.
yeah.
Who was our presenting sponsor last year?
Eastern's good. Eastern has always been presenting.
For the last 7 years.
So if they want to market.
Well, and they'll get first right of refusal. So if I get 3 people who are interested and one of them's Eastern, Eastern will automatically get it because they've been the presenting sponsor.
And
That's all.
10 table, usually 10. Yeah.
Mhm.
That's why last year Eastern had that whole big section, all to themselves. And that's what it'll be for any presenting sponsor, that much space.
I would talk to Liz about the corporate because that would be cool to have dental, have it all.
Yeah, once we get the forms out, you'll see all of the perks. Yeah, it's a lot, but.
And the more interactive your space is, the more people will come to it and be part of it. We are looking back at the mammogram bus coming in. I'm already applied for the Blue Cross Blue Shield bus. I'm trying to get all of the screening services that we possibly can out there.
Stroke.
Yeah. So that way we can do as much screenings as we can.
Are you trying to do immunizations or is that?
Yeah, we'll try to see if we can get the DOH out there, because we're trying to get the back to school stuff, so that they can do that. Birth certificates, if they need it. So yeah, and if there's something that you know that you guys do, that's in a screening type something, or have something like that, let me know, because I might not know about it, or not have thought about it, or might have forgot about it.
We try and showcase what the screenings are gonna be, so people know to come. So if
Yeah.
you're gonna do a screening, if you have the ability to do one there, please do. Because sometimes this can be the only time that these people get these kind of screenings. So we're thinking like blood pressure, stroke, immunizations, records, all, just anything that you can think of. We had fall risk at some point, I can't remember all.
The colon, we didn't actually have colon screening.
I
would be wrong.
I will get out, but it's that, Cleo made for their lab, where they can do remote, hemoglobin tests as well. They, but I go there,
Yeah, so if you have contacts, if you know somebody, either have them contact me or send me their stuff and we'll contact them. Just don't rely on this verbal conversation on me remembering what happened in 10 minutes.
Yeah,
Yes,
we'll be inviting everybody to the first expo meeting, and that's where we need all of these ideas. We need ideas on who to contact. If you have contacts, we'll share the information and you can share it. Cause that's how we get everybody there and make it confidence in the expo.
All right, anything else? Okay,
I forget. DOH with the mobile.
yeah, they're on the list.
Oh, they are.
Yeah,
Okay. Yeah,
and we talked about it 2 seconds ago.
yeah, we've been doing a lot of stuff already behind the scenes.
It's only
The one that
one,
Monica, the one that Monica.
so Truman does STDs,
Okay.
DOH will do immunizations.
Thank you.
And I know you were talking about breast and cervical cancer. I just wanted to say I'm with the Department of Health Breast and Cervical Cancer Program, and we do we could potentially, I don't know, I think last time you had your own mobile event, mobile mammo thing. Our thing, we need to be connected to a clinic in order to refer patients to the mobile event. And so it's something I can talk with someone about if that's something that you are interested in.
You can send me an email.
Okay,
Um,
okay, that'll work. Thank you.
all right, with that, I'm gonna go ahead and move on. So we have the Healthy Hearts Ambassador Program. Ben, are you on?
I am on. Can you hear?
So the screen share is available. You should be able to take over
Okay,
Do I need to stop share on my side?
okay. Can you see the PowerPoint presentation? All right, so good afternoon, everyone. My name is Benjamin Hawkins. I'm a project manager with the Constellation Consulting Group out of Albuquerque. We are working with a group of Health and Heart ambassadors in Chavez County. I wanted to do a quick presentation on the program itself, what it entails, and give you an update on the program, what's happening in Chavez County. So thank you for the opportunity to be here with you and give you this update. Hopefully, I can go through, and if there's time, we can ask questions. I'd be happy to answer any questions, okay? So the Healthy Heart Ambassadors Program is a blood pressure, self-monitoring, and nutrition program that's supported through the New Mexico Department of Health and the CDC, Centers for Disease Control and Prevention, the federal level, okay? So what is a Healthy Heart Ambassador? Well, they are trained facilitators for this blood pressure self-monitoring program. We're doing this program in 3 counties in New Mexico as a pilot project, if you want to call it. Bernalillo County, Chavez County, and Luna County, who happen to have the highest rates of cardiovascular disease in New Mexico. So we're trying to build a case for this kind of program and expanding it to other counties in New Mexico to help people deal with high blood pressure and cardiovascular disease. It's a 4-month program that helps participants build skills and capacities to 1, manage their high blood pressure, 2, identify and control triggers that raise their blood pressure, and 3, adopt healthier eating habits. I also like to add a 4th one that's not here, but it's really important too, is we also work with participants and people with high blood pressure to really develop their skills and communication skills to work closer with their healthcare providers so that they can work together to manage their blood pressure more effectively and get better health outcomes. Yeah. So why self-monitor? Why self-manage high blood pressure? Well, the evidence is very clear. Self-management and self-monitoring programs do work, and they really help improve health outcomes because they give patients or participants a stronger self of control over their health and their behaviors. They identify trends in blood pressure changes. They help manage blood pressure, and they increase adherence to treatment. And that's why it's important to build those skills to communicate with their healthcare providers more effectively. And finally, it helps improve health literacy. We know that when people get timely and good information, they make better health choices. So that's why we're wanting folks to self-monitor their blood pressure. The role of a healthy heart ambassador is to model and coach proper technique for the role is to model and coach proper technique for home blood pressure monitoring. So we're training people so that they can train others to monitor their home blood pressure at home, and also to deliver weekly support messages so that they're in contact with these folks, supporting them, helping them, and reminding them to monitor their blood pressure. They also host monthly nutrition education seminars. They have already developed seminars that they deliver to these participants so that they make better eating choices and hopefully stay healthier. And they also offer office hour consultations. These office hour consultations are 10 to 15-minute check-ins with these folks so that they can go over, and make sure that they're, following proper technique for measuring the blood pressure at home. And, to check in, see how they're doing, and how they're communicating with their healthcare providers. Now, in order for someone to be eligible to participate in this 4-month program, they must be at least 18 years old they have been diagnosed with or told they have high blood pressure, but, we rather that it come from a healthcare provider. It needs to come from a professional who has told them, and diagnosed them with high blood pressure or hypertension. They must not have experienced a recent cardiac event in the last 6 months to a year, either a heart attack or a stroke. If they do, they're not eligible because these folks require specialized professional care, and these folks are not healthcare providers. The participants must not have atrial fibrillation or other arrhythmias, or must not be a risk for lymphedema, because again, these require professional specialized care from healthcare providers. Now, we train these ambassadors. We have completed training actually there in Roswell, and we train them on how to identify and recruit participants for the 4-month program, and then we train them on how to model correct blood pressure measurement technique so that folks can do this at home. We help them, how to set up their office hours, how to set up and deliver the nutrition seminars, and other types of training to make sure they have the resources they need to run these 4-month programs. Okay. Now, the benefits of this program for the Healthy Heart Ambassadors is they have free access to all the training materials in English and Spanish. They have free access to all the nutrition seminars, including handouts, a variety of handouts in English and Spanish. They got free blood pressure monitors for themselves as an ambassador, and we gave them also 3 blood pressure monitors for their participants so that when they recruit them, they can offer them a free blood pressure monitor to use at home. Okay. We're also providing technical assistance to all the Healthy Heart Ambassadors in the 3 counties in English and Spanish. Myself being bilingual, whatever they need, we provide that technical assistance so they'll be successful in delivering these 4-month programs. And the greatest part of this is that each of these ambassadors can earn up to $1,000 stipend with the training and implementing 1 4-month program. So for the folks that trained, they already got a $250 stipend for attending the training, and then they'll earn some other, actually 2 other deliverables. They'll get up to $1,000 stipend for participating in the Healthy Heart Ambassadors program. Okay. Myself and my colleague Bianca Paletti, who are the project managers. Again, we're working in Chavez and Bernalillo and in Luna County. Okay. So with that, I just want to give you a quick update. We did a full-day training in Roswell on January 21st. Alpha Home Care hosted the training, and we're really thankful to Alpha Home Care for hosting the training. We had 6 folks who got trained and certified, so they're now Healthy Heart Ambassadors in Chavez County, and they're already recruiting people. They can recruit 3 to 5 participants each to participate in the 4-month program. They have the blood pressure monitors, they have all the training materials, they have the nutrition education seminars in their handouts. So they're going to start the program February through May, so that we run the program, we get initial blood pressure readings, and then at the end of May, we'll get a final reading, and then we can do an analysis to see whether the self-monitoring program worked and improved blood pressure of the participants, and hopefully getting healthier outcomes. So right now we have 6 Healthy Heart Ambassadors who are trained, 3 from Alpha Home Care, and 3 from 3 Sons Birth Midwifery and Doula Services there in Chavez County. So we're very thankful for their participation. They were very motivated, excited to be part of the program, and they're already recruiting folks. I just heard from Alpha Home Care. They already have quite a few participants starting the program. 3 Sons Birth is also in the process of recruiting, so we're hoping that they get the program started and we can start collecting data so that we can see, how the program is going to be working and how effective it will be in Chavez County. So with that, I turn it back to the group, and if you have any questions, I'd be happy to answer.
So we got 2 minutes for questions. Does anybody have anything? Anybody online?
No, thank you.
In that case, thank you, Benjamin.
You're welcome. And thank you for the invitation to present, and thank you for the invitation to collaborate in Chavez County.
All right. Our next presentation is from the National Health and Nutrition Examination Survey. Are you guys online?
Yes, we are.
Okay. I didn't get a PowerPoint, so you can share your screen.
Oh, yeah, sorry. I don't know why I didn't go through. I just sent it to you right before this, but I am happy to share my screen. To provide a quick overview, my name is Alexa Ortiz, and I work with the National Health and Nutrition Examination Survey. The NHANES survey, just easier to say the abbreviation, is part of the U.S. Center for Disease Control and Prevention, or it's run through the National Center for Health Statistics, part of the CDC. And we're going to be working in Roswell and Chavez County a little bit later this year. So to provide some quick introduction about the survey and the work that we're doing, I have a video that I was going to share because it just gives some good overview information.
Are you guys able to hear?
Was it?
It's coming out of the Allen, not the TVs.
Click on the audio and change that. It should be.
Let me know if you can hear it.
The National Health and Nutrition Examination Survey, or NHANES for short, is one of the nation's greatest resources for understanding the health of people living in the United States. For more than 60 years, NHANES has measured the nation's health and nutrition. Now we're coming to your community and can't wait to see you. NHANES is different from other surveys. We collect data from both in-person interviews and physical exams. Having both types of information makes NHANES data more complete and useful. How does NHANES collect data? First, we scientifically choose communities to visit each year that will best represent the United States. Then, we mail letters to randomly selected households in these areas to tell them about NHANES and that we'll stop by to talk to them about being part of the survey. Finally, we visit these households in person to see if people living there are eligible and willing to take part. If so, we'll interview them about their health. This takes about 1 hour. After the interview, NHANES participants schedule appointments for a health exam at our mobile exam center and dietary interviews by telephone. Health exams take place in state-of-the-art mobile exam centers that travel around the country. Our team of highly trained and experienced health professionals perform the physical exams. They measure height, weight, and blood pressure, just like in a routine doctor's exam. They collect urine and blood samples to test for things like heart health, kidney and liver function, and environmental exposures. The exam can include other tests that are not always done at a regular health checkup, like an oral health exam, a vision or hearing test, or a bone density scan. The exam that each participant has depends on their age and sex, but most people spend about 2 hours at our mobile exam center. Participants get some of their exam results that day, while other results will be available later via a private portal. Participants can share exam results with their doctor if they want. NHANES will not share results to anyone other than the participants. NHANES participants receive a generous token of appreciation for their time and effort. Participants can be proud of contributing to a critical national health study, influencing policies and programs that improve health in the United States. How are participants selected to take part in NHANES? Having every person in the United States participate in NHANES is not possible. So instead, NHANES makes sure that all kinds of people are represented in the survey in a way that reflects what the country looks like. We call this creating a nationally representative sample because it allows us to provide health estimates for everyone, not just those who participated in NHANES. About 5,000 people participate each year. Each person selected represents other people in the country. To make this happen, we divide the United States into distinct geographic groups based on how similar they are to each other. Local areas are selected from each group to represent the nation as the first step in NHANES sample selection. Within each area, neighborhoods are randomly selected, and then households within these neighborhoods are randomly picked. Each selected household is mailed information about NHANES. Then an interviewer comes to the home, and an adult household member completes a short survey about all the people living at that address to see if anyone living there is eligible. We may randomly select multiple people from each household to take part in NHANES. Each person selected represents tens of thousands of people like themselves across the United States. If someone is selected and decides not to participate, no one can take their place. Why are NHANES data so important? NHANES data inform decisions about health policies, education, and research for our country. They help create snapshots of the health and eating habits of the U.S. population. NHANES data help us see whether people are getting more or less healthy over time. The data also reveal how common certain diseases are and can identify any new health issues. These snapshots help shape new health policies and programs. NHANES data have been used to track health differences across groups in the nation. For example, NHANES found significant differences in awareness and treatment of high blood pressure across different racial and ethnic groups. Using information from NHANES, health professionals and policymakers can make informed decisions on how to address our nation's health concerns. NHANES data have also been used to create pediatric growth charts to track children's physical development, discover the steady decline in secondhand smoke exposure, help us figure out what chemicals in our food and environment may be harming people's health, show the importance of adding nutrients and vitamins to foods in helping prevent birth defects, and inform recommendations for nutritional labeling. Over the last 60 years, our data helped make changes in public policy and laws. In the late 1970s, after NHANES data revealed an alarming number of Americans had high levels of lead in their blood, Congress passed laws to remove lead from gasoline and paint. Over the next 20 years, NHANES data showed how levels of lead in blood declined. By the early 1990s, the problem was largely under control. How are data from NHANES participants protected? All data we collect are kept private. We are bound by law to protect NHANES data and have been doing this for more than 60 years. Participants must give consent to participate in NHANES, and their personal information is not shared. NHANES data are shared with others only after we remove anything that could identify participants personally, including the part of the country where they live. Combining data from all participants together gives a picture of our country's health while protecting the privacy of NHANES participants. How to help NHANES succeed in your community? We are so excited that your community was selected to be part of NHANES. We need your assistance, support, and participation over the next few months to make NHANES a success. Your help now will create a legacy to help improve the health of the U.S. population for decades to come. It's so important that everyone in your community who is selected participates in NHANES. A wide variety of participants and the support of the whole community are vital to making NHANES data representative and accurate. NHANES has a long history of working with many different communities, and we ask for your help to continue this work. Every year, NHANES is conducted in dozens of communities, interviewing and examining about 5,000 people. We want to hear from you how we can make NHANES a success in your community. We look forward to working with you on this important effort to understand our nation's health one community at a time. By supporting or participating in NHANES, you can help make your community part of something big with meaningful, lasting impact. Together, we can ensure NHANES represents everyone in the United States. To learn more, Visit www.cdc.gov/NCHS/NHANES.
Okay, so that was a quick overview video. Now I'm going to choose some slides that were more specific to the work that we're doing in the community.
You will have to speak a lot louder because we can barely hear you.
Okay, sorry. There. Okay, so this is some slides just as a follow-up to a video that I just shared about the work that NHANES is specifically doing in Travis County. So just to reinforce some key points from the video, NHANES, like I said, run by the National Center for Health Statistics, part of the CDC. It's really one of our greatest resources for understanding the health of the people of the United States. It helps us look to see if people are getting healthier. It helps us keep track of issues that we're aware of, and it also helps us flag any new issues that we should be concerned about. And this has been going on for 60 plus years. So for 60 years, NHANES has been working to collect information that helps track essentially the health of the people of the US. It's just like a snapshot. And the data that we collect is done through a couple of different avenues. So as we mentioned in the video, this is done through personal interviews in the homes of selected participants, as well as telephone interviews. And we invite people to come to our mobile exam center for a health exam. So specifically for the work that we're doing in your community, it's going to start towards the very tail end of March, early April. That's when our field interviewers are going to start working in the community, visiting people's houses. Folks are going to start receiving letters letting them know they've been selected in early March as well as mid-March. And we understand that participation in NHANES takes time and that people go through effort to participate. So there is a token of appreciation that we give for that initial field interview survey that's done. Folks receive a $25 token of thanks. And then once again, we understand that coming to the mobile exam center also takes time. The mobile exam center, or the health exam that happens there can take up to about 3 hours. So we understand that, like I said, that takes time. So folks will get a $100 token of thanks for that, as well as NHANES offers compensation for transportation, childcare, adult care costs, and folks get the results from their exam that they receive, which includes a lot of components that might not be in a traditional physical. Like it can include dental exam, eye exam, bone density. So it really has a wide range. And a quick update is that we confirm where we're actually going to be set up in Roswell, because we were trying to figure that out. But we're going to be on the Eastern New Mexico University campus in Roswell. So we're hoping that that's pretty central and a location that folks are familiar with. And then the last part, like I said, that was briefly mentioned in the video, dietary interviews that just happen over the telephone as a follow-up, and folks get $60 as a token of thanks for participating in those. So really why I wanted to come present today is to share some information about NHANES, because if I'm being honest, I had never heard about it until I started working on the survey. So just to kind of share some information with you all so you all are familiar with it, and then also to help address any questions that you might receive from community members. And also just to help promote the survey and bring awareness that we're going to be working in the area. Because I myself or the CDC can't share information through like our social media channels that we're going to be working in Roswell. So we really look to the community to help share information through your channels, like social media, newsletters, posters, etc., to help just get the word out about NHANES. And then doing that also really helps ensure residents know that we're legitimate, we're not going to steal their data, we're a trustworthy initiative. So I think that pretty much sums it up. I know that was a lot of information really quickly, so I really appreciate you all allowing me to join today. And happy to answer any questions about NHANES or the work we're doing in the community.
Does anybody have any questions? Is this for the entire county?
No, just for a couple areas closer to Roswell. So it's the data that we're getting is not going to be representative of the entire county, but when it's put together with the data that we're getting in other locations, it's representative fully of like the United States. So so the short answer is no, we're not going to be the entire county, but more closer to Roswell.
But will it be just Roswell or one of our outlying cities?
Right now, the work that we're going to be in closer to you all is just going to be in Roswell, but we're also going to be in Clovis a little bit later this year. And I say later, I mean like the following month.
So is Eastern already locked in as your site?
Yes, correct.
Okay, because that's not central.
No.
It's Eastern New Mexico University for that, and then we're going to be at the Clovis Civic Center when we work over there.
Yeah, the Eastern New Mexico University Roswell is not center for Roswell. It's at the very edge of the town.
Yes,
It's extremely isolated.
Yeah, and that's kind of, unfortunately, the vehicles that we have, like the mobile exam center, they need a lot of space. So that was one of the spots that we identified that was willing to accommodate the vehicles, that had enough space in their parking lot for us to like set up and allow for folks to park.
Okay. I might send you an email later after the meeting. Any
Sure.
other questions? Anybody online?
Yeah.
All right. With that, Alexa, thank you. Hopefully some of us in this room get selected and get $160. All right, no questions. We'll go ahead and move on. Now to the agenda. All right, so next month for March, we are going to focus on ChavezCounty211.org, which is the Chaves County version of Yes New Mexico Connect, which is the state version of Find Help. So it's the closed loop network system that the state is using. Now, the way this works is that Find Help is a nationwide entity. They partnered with New Mexico and through Yes New Mexico Connect. If people use Yes New Mexico Connect, that information is gathered at the state level and doesn't trickle down anywhere else. We are one of the few counties that we were able to get our own version of it, so which is ChavezCounty211.org. If people use it and refer to it and connect through it, then we can see the data. So that way we can figure out what our needs are in Chaves County, if we're actually meeting those needs, if we need to find things. Now, when I say that, if it's on the national level and somebody puts in their information on the national level, we still see it on ChavezCounty211.org. If they put it at the state level, we still see it at ChavezCounty211.org. If we do it at ChavezCounty211.org, they can still see it at the other levels as well. So it's just where they go to access the information is where we can pick up our data on it. So as we're promoting this, we're going to promote it as ChavezCounty211.org. And just in case you haven't figured it out, it's ChavezCounty211.org. So that way we can start seeing our data on it. If you have not put your information in ChavezCounty211.org and you want to start ahead of us, you can. But we'll walk you through the process next month on it. And with that, if you go to the next page, this is our 211 report for ChavezCounty211.org. We're really, because we don't have enough information in it, we're not using it. But this is some of the stuff, like how we'll be able to start seeing some things on it. So we can tell you what our top needs are. This is for January. It's always utilities and housing. It doesn't change. But here, No, that says Texas, not Texas. Sorry, I can't see. So sometimes we get a lot of calls, for Texas. And so that'll start picking up. So here are the top referred agencies, for the resources, the faith-based organizations, because they do the, utility assistance. LIHEAP, again, is the other one, Salvation Army, Texas 211, and then we have no housing resources, or we're very limited on housing resources. So just in case those of you who do navigation, HUD applications for Chaves County are not open, or in our region, there's no HUD applications that are open. Alianza does not have, their, housing assistance program, their rental assistance program, that is done. So there's no rental assistance. Sorry? Nope. So as of right now, we have no rental assistance.
From Alianza, they're done then.
They're done.
They have the emergency. Wait, they have to do the DAT and the state, and I don't, it's like really hard to access.
Yeah, so,
What about,
but not for what we get calls
what
for.
about keeping families together?
They don't, they have,
Their referrals have to come from a very, very specific sources. It has to come from CYFD or community partners. It cannot be just walking in, anybody. It has to come from.
and they have to meet those requirements of having children, and then they have to be certain age.
They can come to the FRC and then like we can assist them as much as we can, and then we can refer them to KMT. So they can come through.
The other resources.
Yeah.
Yeah,
Okay,
Yeah.
great.
They can just get
Right.
yeah.
the process to get referred.
But does the resource center have funds to help?
It just depends, like it just, like sometimes,
Keep my key.
yeah,
Yes,
it's just, it depends on the case.
Okay, and the reason I'm asking that is because I tracked it for the first 5 days of the month, $20,000 in requests for housing assistance. 5 days. So when I ask these things, because one of the frustrations with all this is that they get referred to somewhere else who doesn't have resources. So then they refer them to someone else and then they're mad and they're angry and then they're calling me back and cussing me out again. And it's like, I'm sorry, I want to make sure that I send you to the right places on where people can help. So like if you have very specific disqualifiers, those are the things that we need to know, because like if they have to have children to be able to go there, then we need to say, okay, look, and we're tracking things like that. And if we're not tracking it, we can start tracking it. So that way, as we start navigating out and pushing resources, we're not sending them all over the county to try to figure out how to get help. Because 9 out of 10 times, they've already pretty much have called everywhere. And then they've come back again around. We get called several times because when they call United Way, they come back to us again. And they don't realize that in Chaves County, United Way doesn't do individual assistance.
Lacoste Behavioral Health has 9 vouchers for their severe mental illness, but they're not taking clients until April. So I'm desperately looking for a practitioner that can do an SMI assessment. Because they can then be referred to Lacoste just for that.
Right, yeah, so Linkages has housing, but it's not rental assistance.
So
It's not rental assistance as the normal, just regular people who can't pay their rent.
Right. So if anybody knows a practitioner that can do SMI, we need to have a conversation. Thank you.
All right, so you can see that, and I went ahead and I put the numbers in here for the 1 week that the warming center was open in January. And that's for Salvation Army, Westminster with Food Not Bombs, and the Homeless Coalition. There was 374 beds filled in that week. The warming center is still open till March 15th at Westminster. Right now, they're the only ones that are doing it. And it's roughly about 30 to 35 people per night. If you do wraparound services and homelessness or unhoused is your target market, you need to get with them and see about going and actually connecting with them and doing some some outreach there, because you have them
Right there.
right there.
And, with that, we're having on the 19th, there will be a multi-agency with LaCosta, DOH, and myself to help them with STI testing, applications for Medicaid, and, STI, the American STI testing, and birth certificates, and then I'll be helping them with their documentations for IDs. This Friday, we will have Workforce Solutions helping, several individuals with applications, job applications and training. And then Saturday, we're having a drive-through wagon for veterinarian services for shot, tutoring, spay, minor injuries, and different services. No, it's open to the community.
And since Geneva kind of just jumped ahead on our agenda there, we'll go ahead and open it up to announcements. We've got about 8 minutes. We'll start in the room and then I'll go to online. Anything? Geneva, were you done? I'll come back to you.
We have, a nutrition class this next Thursday at 5:30 here.
So that's CASA has a nutrition class?
Yeah, Eversea, yeah, sorry, Casa Kids. And then on the 26th, we have Money in Me, which is a financial literacy class at 5:30 as well.
Would you guys be willing to do the Money in Me at the center? Morning center?
Anyone?
And that nutrition class is it for anybody?
Yes.
Yeah, and we do have like a link online where they can sign up just so we can have an idea of like how much food to provide. So we teach them how to cook it and then they're sent home with some of the ingredients to make it at home as well.
Okay. Are those flyers already out?
Yeah.
All right. Anybody else in the room? Okay, Alexa, you have your hand up?
Yeah, I just wanted to provide a little bit more information about the Eastern New Mexico Roswell campus and why that was selected. So I was able to look at the map real briefly of where we're going to be working. And it was selected partially also because it can accommodate the mobile exam center. And then also it's nearby a lot of the communities that we're going to be working in, or it's close to them. So might not be 100% central to the actual like town of like to where a lot of neighborhoods are, but it's nearby a lot of the ones that our field interviews are going to be visiting.
Okay.
Did she not share?
So I'm not sure who asked it, but I hope that provided a little bit more information.
In near Roswell.
Yeah, so would it be also like Arthur?
Is it like Dexter? Is it Midway? Is it the base area? Is it?
So
Able to share that?
they're asking if you can share, is it gonna be like Dexter, Hagerman, Lake Arthur, or just South Roswell, the county portion of it, if you're able to share that?
Unfortunately, I'm not able to share it. The specifics around like the exact community we're going to be working in as considered protected health information. So I wouldn't be able to get too more specific beyond that.
Okay, all right. Then I won't be contacting you because you're in your target area, so you're good. Stephanie?
Yes, sorry, my mic or my camera's not working, but I'm with the New Mexico Department of Health Breast and Cervical Cancer Program, and I did look, and in the Chavez County area, La Casa de Buena Salud is one of our locations that provide free breast and cervical cancer screenings to people who are uninsured in your area. So please let people know to go to La Casa de Buena Salud for services if they need that. Thank you.
Okay. Stephanie,
Yes.
is that the one that's in Hobbs?
We are located, so it looks like the Casa de Buena Salud in Chavez County, and yes, in Hobbs, correct. Yes.
So the one in Chavez County, I'm sorry, this is Monica, is right here by the health clinic on Grand.
Okay.
So, but they're not doing it through that La Casa, right? The mammograms, they have to be able to go down to Hobbs to have the screenings done. Is that correct?
They can get signed up there. I'm sorry, I apologize about that. So yes, so though La Casa de Buena Salud is where they can enroll in the breast and cervical cancer program. And then when they get enrolled in the program, then they can get the cervical, breast and cervical cancer screenings and through the over 90 different providers throughout the state.
Are any of those providers here in Roswell?
I'm looking right now, and yes, it looks like diagnosed Chimera cancer. Oh, that's for cancer treatment. Hold on. Treatment. For treatment centers in Roswell. Yeah. PMS is one of the enrollment site, and then yeah, and then they go to Artesia for imaging.
Okay. Thank you.
You're welcome.
Loretta?
Hi, can you hear me?
Yes.
Alrighty. Well, we had signed up Road to Recovery to speak about youth education. So, Gary, when you can put us back on the schedule, we have really good data about what youth are thinking in terms of mental health and also substance use. This is an annual survey given to New Mexico high school students. So we have been asked, I mean, part of us live in Albuquerque, part of us live in Roswell. We're asked.
We can't hear you, Loretta.
We are asked to speak to a lot of schools in the Albuquerque area and want to really work to get the word out to Roswell schools. So if you can put us on the schedule, Carrie, we would still love to present on youth education when you have a chance to look at the schedule. Again, I know that 2-in-1 is important, but look it over and see where we can present. Also, the race is back on. The bad weather is gone. It's going to be beautiful. Racewire.com or in person. March 28th, Saturday is going to be a beautiful day because Roswell just has that beautiful weather usually, right? Except for this last race day. So anyway, hope to see you all there. Vendors as well. We have a new partnership with Dead Dads. These are people that have actually lost a father due to substance use. So anyway, they're going to bring out basketball courts, and we're really trying to attract the youth. So I'm getting all my notes back out to the schools again. And so if you can do your part, post our flyer, I'll send it on to Carrie. Thank you.
All right. Loretta, I'll get with you. April is our youth one. So we are at the end of time. So anybody, Danny, your hand is up. So if you could go fast.
Just wanted to go to make a quick announcement that Together Veterans for Chaves County was selected by Roswell Honda as the recipient for the 4th annual golf tournament. So sponsor packets are being put together and we'll get them out.
Yeah. All right. So Jennifer is going to do the will while she's pulling that up. Together with Veterans meeting is February 21st. The Behavioral Health and Wellness Committee meeting is February 18th. And the next membership meeting is March 11th. And we will be moving locations due to we'll be moving locations. So we're going to the library at 310 North Pennsylvania.
We're moving because we're uncertain how long CASA's going to be in this location. The FRC is the last one standing here. Okay, Paula, you won.
And the winner is Paula. With that, unless anybody has anything dire that they have to say.
Yeah.
All right, I will call the meeting to end.
He said it was March 10th.
March 11th. Is there somebody, Stephanie, do you have something else to say?
Yeah. No?
All right. Y'all have a good day.
No, I'm sorry, I have to lower my hand. Sorry. Thank you. Thank you.